A hearty good afternoon and welcome to the session on laparoscopy and hysteroscopy. We are glad to have Dr. Avani among us today to help us understand the topic. Laparoscopy and hysteroscopy are two of the most common minimally invasive gynecological surgical procedures to either diagnose a woman's infertility or correct problems that cause infertility and miscarriage. Dr. Avni will take us through that and more in the session today. Doctor, you have the stage.
Good afternoon, everyone. I'm Dr. Avani, consultant reproductive medicine, Apollo Fertility, Hyderabad. Hope all of you are doing good. So, today I wanted to share some insight on endoscopy we use in fertility on a daily basis. So, now I just want to tell you that what is infertility when a couple is trying to conceive for at least 12 months without with unprotected intercourse and not able to conceive. We generally consider it as infertility or subfertility, and they should seek help of the doctors. Now, coming to our topic today, I just want to tell this is our reproductive system in the female, and as we can see, this is the uterus, two ovaries, and two fallopian tubes are there. So any issue with any of these, like uterus or tubes or ovaries, will may cause our problems of fertility or subfertility. So now coming to the endoscopy. What is endoscopy? Endoscopy is we have a long instruments which are used to check the um, internal of the abdomen, like uterus, ovaries, and tubes, and either through the natural orifices or with minimal incisions of zero point 0.5 centimeter or 1 centimeter incisions. So, what do we do in endoscopy in fertility? So, coming to that, we have laparoscopy and hysteroscopy, and we come generally in fertility patients, we generally combine both laparoscopy and hysteroscopy. So now coming to the laparoscopy. Laparoscopy is minimal invasive surgery, though it is a daycare procedure, and lots and lots of women have been benefited with the laparoscopic surgery. So what when all we do the laparoscopy? Let me just, as I mentioned earlier, like here we have a uterus, tubes, and ovaries. So any issue in any of these, like uterus or ovaries or tubes, we will be considering the laparoscopy. So most commonly, what happens in fertilization is, in our body, the fertilization happens in the tube. The egg goes from this side and the sperm from the vagina, and here the fertilization happens. And generally, when the couple is not able to conceive, we do a tubal patency test known as HSG or by SSG. In that, if we have a doubt of the patency, then or it has showed some block of the tubes, so then we go in with laparoscopy, and where we have an overview of the uterus, tubes, and ovaries, and we do a proximal cannulation of the tubes, and we try to open it. And first we confirm the diagnosis, like whether the tubes are really open or not, and if they are blocked, we try to open the block with the proximal cannulation. This is most commonly used. And one more thing is, we in the tubes, if with the scan we see a little dilatation or tubes like hydrosalpinx, that water filling in the tube, which is dilated tube, for that also we use laparoscopy. And in laparoscopy, depending upon the hydrosalpinx, either it is clipped, um, or the clipping is done, or salpingectomy is done. And now after that, this is the most two for which are used for the tubes. Then coming to the ovaries. And in the tube, another thing where we do laparoscopy is for the few patients are sterilized to stop the family or family planning surgery has been done, and for them we do this tubal recanalization, where microscopic the two ends of the tubes are attached laparoscopically, and patency is established. And one more thing, laparoscopy where it is done is for the ectopic pregnancy. What is ectopic pregnancy? The pregnancy is in the tube. See, normally pregnancy happens in the uterus, but here the pregnancy happens in the either one of the tubes. So then the laparoscopy is useful. Next comes to the ovaries. So the most common conditions which we see in ovaries are where we see is PCO these days. But first, the primary treatment. So we have few questions where they have told that. The use of HCHSG7 scope, and what condition the patients the HSG catheters need to be used. Okay. See, for the generally the HSG or the tubal test is done between day 6 to day 10 of the cycle, and the catheters or the for the HSG it is done under X-ray, and there are different sizes in the catheters depending upon the cervix size, where there is a small cervix and opening is small, we have a smaller size catheters, and for injecting the dye, and we have different catheters, and depending upon the size of the cervix we use the catheter which has to be used. And there is another question asking how do you do the cannulation of the tube. So it is done hysterolaparoscopically, where a thin epidural catheter, for example, is used. Foam catheter is used through under vision. We pass into the ostia through the hysteroscope, and and we push the dye, where in the laparoscopically we can see that the dye is passing, and any small blockage or anything can be cleared with this. So, going on to our topic now, um, coming to the PCO. Uh, Coming to PCO, then the first line of management is not the laparoscopic ovarian drilling, and as first initially we have to see all the hormones, and pre-treatment has to be given. For if the LH is high, the treatment has to be given, and we have to try ovulation with simple medicines or gonadotropins. And if it is resistance, then only we take up for the lap ovarian drilling. And here thin lean PCO have benefited more with lap ovarian drilling rather than obese. That's what we have seen in our practice. And the other thing where laparoscopy is done in ovarian conditions or ovaries is the large ovarian cyst, where we see a large cyst more than 5 centimeters. We want to take it out. And the another condition where most commonly laparoscopy is used is the endometriosis. What is endometriosis? Is the endometrium is the inside layer of the uterus. In some people, some women, this endometrium along with inside of the uterus, it is there outside of the uterus, which is deposited every month on the ovaries, tubes, and in the pelvis, bowel, in the bladder, everywhere. So that is called as endometriosis. And sometimes in the ovary it gets deposited over time, and there is a cyst formed, which is called as an endometrioma. And if it is large, it's always better to remove it. And if any additions or any side endometriotic spots are there, to follow it is always better. And now coming to the uterus, the commonest thing which we see is the in the uterus body, in the laparoscopy, is the myoma, where I'll just, yeah. These are the myoma or the fibroid, where the different places you can see as it's in the muscle intramural, and sometimes it is outside, which is called subserosal, and sometimes it is pedunculated and it's inside the cavity where the pregnancy sticks. So with all these kind of fibroids, if it is outside the uterus, no need to go for surgery, we can just leave it. If it is inside the cavity, we need to remove it, go laparoscopically as well as hysteroscopically. So these are the conditions where we do laparoscopy. And now coming to the hysteroscopy, as the cavity of the uterus also has to plays a very important role, and the endometrium plays a very important role in the implantation of the pregnancy. So so these are all the endometriotic spots. And as I told, the dilatation of the tube, that is the hydrosalpinx, which I was talking when we do laparoscopy for this, where it is dilated, you can see the normal size of the tube. And now coming to the hysteroscopy, as I told, the assessing the internal of the cavity of the uterus is very important, as the endometrium and the uterine environment is very important for the implantation and to have a healthy baby. So with the hysteroscopy, but it is also an endoscopy, it's a long instrument where through the natural orifice we see the inside of the cavity of the uterus, where we can do a diagnostic where we can see whether the cavity is all fine or anything we are missing on the scan or the regular procedures. Or we can use the hysteroscopy for a procedure, therapeutic procedure, such as, see, in the scan, if we diagnose polyp, that can be removed with the hysteroscopy. Polyp is a growth from the endometrial, where it also prevents the implantation. Then, as I mentioned about the fibroid, which comes inside the cavity, where you can see the cavity, and it prevents the implantation, that can be removed hysteroscopically. And one more factor where hysteroscopy plays a vital role is, sometimes there are congenital anomalies in the uterus, where you can see a septum in between, or septum means there is a cavity, there is a, as you can see here, the uterus cavity has to be complete, and there is a, if there is a septum, there is a septum in between, and that can be removed under vision, that is called a septate uterus. That can be done. And in a few women where we have a recurrent implantation failure, that is, we have kept a very good embryo but still there is not implanting, then their hysteroscopy plays a very good role. And we can do a office cystoscopy, where it is an OP procedure, where you need not have an anesthesia or anything, and you can just go walk home in 1 hour, where we can assess the cavity just in your OP table. So in that, because we have a very thin 2.9 mm scope, where it is very thin, and it's not painful, and it can be done in on OP basis. So now the commonest questions I get in endoscopy in fertility is, patients ask me, will laparoscopy improve my egg quality? So now it depends on for which condition we are doing laparoscopy. In, like I mentioned earlier, if it is for PCO, definitely the uh, laparoscopic ovarian drilling will help, and we expect a pregnancy within 6 months. And and if we are doing laparoscopy for the tubal blockage and we could open it, we have seen many patients conceiving next month itself. And And endometriosis also, we can remove the endometriotic cyst, and also the cauterize the endometriotic spots, and it definitely helps and increases the fertility for the particular patient. Now, one more question which I get is, can endoscopy improve the chances of fertility and conception? Definitely yes, because when we are doing a laparoscopy plus hysteroscopy, we are having a direct vision of the outer surface of the uterus, tubes, ovaries, the structures around the pelvis, everything. So better visualization helps, and as I mentioned, all the issues which were diagnosed can be removed, and definitely they increase the fertility rate. So so the one more question which I get is, frequently asked question is IVF better or laparoscopy? So though IVF is much less invasive and than laparoscopy, and we have better success. So definitely in one context we can say, but still, as if they are like any hydrosalpinx like water in the tube, or any dense additions or bad endometriosis, it's always better to do laparoscopy and go for ART or the IVF procedures to prevent the poor outcome in the these patient. So how after how long after laparoscopy can we expect a conception? So again, it depends on for what condition we are doing the laparoscopy, and generally we within 3 to 6 months of laparoscopy we expect a conception, um, and we will have to reassess even if they didn't conceive after 6 months. Then what all should be done before going for lap? Now, so okay, now we have decided that this particular patient requires laparoscopy. So we how we do, what is the procedure? So in the laparoscopy, what happens is we don't give a big incision. There will be a small cut on your tummy above the navel, which is around zero point 0.5 centimeters, and another one around zero point 0.5 centimeters, and instruments would be placed and a camera would be placed, and first to see, visualize, and then to do the therapeutic procedures whatever are there. And we will give you all instructions. First we'll check all the health is all right for the to be taken up for laparoscopy. And sorry, there's some. Okay. And we it is a daycare procedure. You will be coming in the morning, and the procedure would take around 45 minutes to 1 hour, and in by evening you'll be sent home. And how many days should you take rest after laparoscopy? So at least a week. We should uh, we should at least give the body to recover. And what care should be taken after laparoscopy? Have a healthy diet, try to move out of the bed, and give body proper healing time, and the patient would be all right. As I mentioned, someone is asking about what is office hysteroscopy. So it is a diagnostic procedure. Basically, hysteroscopy is used to see inside the uterus, and these days the office hysteroscopy has become very popular, as we have very finer instruments which have come into the market, which is like 2.9 scope, which is very thin. And so it is, you have a doubt in a scan that there is a polyp or there's some irregularity or something, just to diagnose immediately on the office table itself, you can do the hysteroscopy, and the patient can go home walking. Then another thing which they ask, the frequently asked question is, how long after a hysteroscopy is done they can plan conception? The immediate month you can plan conceiving. after hysteroscopy. So basically, after endoscopy, you need not worry that it's a surgery. But with utmost care, it definitely improves the fertility rate and conception rates. But yes, we have to weigh the pros and cons while deciding for laparoscopy, or it is better for them to go for IVF or assisted reproductive techniques. So, done with experts' hands and all the care taken, nothing to worry about endoscopy. Endoscopy definitely increases lot in lots of people the conception rates, and you need not worry about the surgery and what would be the complications of surgery, or will I recover from the surgery and all. So and you can it's a daycare procedure, and you can just come in the morning and leave by evening. 1 week of rest is enough, and we have seen lot of couples getting benefited by these endoscopy procedures. And it also helps us to visualize inside the cavity, like all the complications, such as different pathologies or problems which we see, such as a polyp, or there is a submucous myoma or the fibroid, or there are complete adhesions inside the uterus where we can remove the adhesions, and uterus is ready for the implantation. And lot of any subseptum, as I mentioned, or septum, where there is a partition between the uterus, where it is preventing the implantation, or the patient is been having recurrent miscarriages, and where there are previous failures. Hysteroscopy helps a lot, and a lot of couples have benefited by this endoscopy, and their conception chances have increased tremendously. So, as there are no questions, thank you so much for patient hearing, and have a nice day. Thank you.